I am Eric Sternlicht, and I'm a compassion champ. There's research in the last 15, 20 years on the importance of fiber. What they do is they go through our small intestine and then get to our large intestine. What gets nourished by the fiber are the bacteria within the large intestine, and we have billions of bacteria within our large intestines. There are healthy bacteria and unhealthy bacteria. If you don't get enough fiber, the unhealthy bacteria flourish, and they impact what your internal environment will be. And in that case, they promote disease and drop in immune function. On the other hand, if you eat a lot of fiber or adequate amounts of fiber, then you promote the growth of that healthy microbiota or healthy flora within your intestines. There's also what's known as phytonutrients or phytochemicals. These are phyto meaning plant, and there are thousands of phytonutrients in the fruits and vegetables and grains. They give them their color, their aroma. They help to protect the plants from bugs, from microbes. We absorb those protective chemicals, and they help to protect our own system as well. Talking about fiber, water-soluble fiber, which helps to lower blood cholesterol, helps in the prevention of heart disease, you can find in oats. It's an excellent source of water-soluble fiber. Apples have pectins, which are also an excellent source. So apples, oranges, and oats would be the three foods, along with all of the categories that fall along with those fruits. When we're talking about water-insoluble fiber, which helps with blood glucose regulation and diabetes, now we're talking about the vegetables, whether they're green leafy vegetables or whole grains. You could have a vegan diet that's very unhealthy if it's all processed. And that's why we went from the term regression diet in the 70s and 80s to whole food plant-based diet now. Whether it be beef or any animal protein to plants or green leafy vegetables, there are hundreds of nutrients in the vegetables, in the green leafy vegetables. You're getting a whole host of vitamins, of minerals, of phytonutrients, of fiber, water that you don't see in animal protein or in beef. In beef, you may get some lipid or fat-soluble vitamins that's in the fatty portion of the meat. You're going to be getting iron because of the iron that's within the muscle cells of that animal. Most Americans eat twice the recommended amount of protein in the diet, and that's part of the problem leading to obesity and to other diseases as well. This new fad Paleo diet is nothing like the Paleolithic prehistoric diet. The Paleo diet in reality was about 125 grams of fiber. It was primarily plant-based, nuts, seeds, grains. And then when they had animals that they caught, they were able to eat it. Today, when people think of the Paleo diet, it's a low plant-based diet and very high in animal protein. I've never heard of a protein deficiency case in the US. Typically, we heard of protein deficiency diets in Africa and third world countries. We look at the Asian countries, and Japan has the highest both healthy life expectancy as well as overall life expectancy. And their diet is primarily plant-based. They have small portions of animal protein, but it's almost exclusively plant-based. Most people think of vegans as, these hippies or, malnourished individuals, and they don't think of them as elite performers. When you sit there and you look at everything from professional basketball players to football players, athletes that you would think are eating enormous amounts of animal protein, many of them are vegetarian or vegan, and they're able to recover and perform at an extremely high level. And in fact, do better on a vegetarian or vegan diet than they do on an animal-based diet. There's less overall stress on your body eating a plant-based diet. And since exercise is an additional stress, you really want to recover from that exercise. You're not getting fitter while you're exercising, you're getting fitter afterwards. So if you can provide yourself with nutrients that help you to recover, help you to be healthy, because as an athlete, you may be fit, but if you end up being sick, it's not going to help you perform. There's a saying that doctors aren't really healthcare practitioners because they're not helping to keep people healthy. They're disease treatment carriers. And if Americans ate a more healthy diet, more whole food, plant-based diet, and were more active, enormous amounts of money would be saved. There'd be much less disease. People would be active later on in life, would feel better. And also, you think of the emotional toll that it has on a patient as well as their family. Caldwell Esselstyn, in an interview, said, and he's a cardiac surgeon, he says that people tell me that a plant-based diet is extreme and is too hard to follow. I think having your sternum sawed open and your chest open and having bypass surgery, to me, that's extreme. First off, Americans eat at least a third of their meals out. It's already well known that the more you eat out, the more money you end up spending on food. So in order to reduce the cost, the best thing to do would be to make your foods at home. It's well known that if you buy foods in bulk, they're going to be less expensive than buying small amounts. If you actually make them from scratch, it's going to be less expensive than paying somebody to process it and make it that you can put into the microwave. So if I was a single parent, I had a family, and I was time limited, so I have a time budget, what I would recommend they do is actually on the weekends with the kids, make up large portions so you're making the entire week's worth of food, and you freeze it or you refrigerate it if it'll last. You'll be spending pennies on the dollar by using beans and other legumes, lentils, and using whole grains that can make up chilies and other foods that the kids would like. It's been shown that if the kids get involved in cooking, that they're more likely to eat those foods. So if you understand that if kids help cook, if they grow a garden in the backyard, they're going to eat that food and get more involved in eating those type of foods. And if you model that, then you're going to end up saving money, and you're going to end up helping their health in the long term, because you're really concerned, yes, with surviving day to day, but think about the life that they're going to have to live for the rest of their lives, for decades, with chronic disease. And they will develop chronic disease if they don't eat a healthy diet.